Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do you give a Prolia injection? You do not give Prolia to yourself. You will receive your Prolia injection from your healthcare provider at their office or clinic. It is a prescription medicine injected under the skin, called a subcutaneous injection, and is given once every 6 months. Prolia is used in combination with daily vitamin D and calcium supplements that you take by mouth as directed by your doctor. Prolia, denosumab, is a bone resorption inhibitor classified as a RANKL ligand, RANKL, inhibitor. It has been approved for 5 uses. To treat osteoporosis, weakened brittle bones, in women with a high risk of bone fracture who have gone through menopause, change of life. To increase bone mass in men with osteoporosis who are at high risk for fracture. To increase bone mass in men who are at high risk for fracture and receiving androgen deprivation therapy for nonmetastatic prostate cancer. To increase bone mass in women who are at high risk for fracture and receiving adjuvant aromatase inhibitor therapy for breast cancer. To treat osteoporosis in men and women at high risk for fracture who will be taking medicines like prednisone, corticosteroids, at certain doses for at least 6 months, glucocorticoidinduced osteoporosis. If you receive Prolia, you should not receive Xgeva. Prolia contains denosumab, the same medicine that is in Xgeva. Do not take Prolia if you have low blood calcium. Can Prolia be given in the thigh? Yes, the Prolia injection site can be in one of 3 places. The upper arm area, the upper thigh area, the abdomen, stomach area, usually in the area under your belly button. You will also take daily doses of vitamin D and calcium supplements as directed by your doctor. You will be given this injection once every 6 months under the skin, as a subcutaneous injection, by a doctor, nurse or other healthcare professional. Read the FDA-approved patient labeling, Medication Guide-Related questions. What's the difference between Prolia and RANKL? Does Prolia weaken your immune system? Does Prolia cause weight gain? How is Prolia administered? Prolia is not usually self-administered. It is an injection given by a healthcare provider. If you miss your dose of Prolia, be sure to get your injection as soon as you can. Call your doctor for further instructions. If your dose is disrupted due to COVID impacts or closures, you may be able to receive your dose at home. AMGEN Nurse Injection Program set up by Amgen, the manufacturer of Prolia. Amgen is making this program available to all U.S. patients who are currently restricted to their homes or do not have a treatment site in their area. Ask your doctor about this option. Can you self-administer Prolia? Another option is self-injection. If your doctor determines that self-injection may be a temporary solution for you due to COVID-related restrictions, you will be taught how to administer the dose. Your healthcare provider can contact their Prolia representative or Amgen at 877 Amgen, 800-772-6436. Directions and an educational video on self-injection of Prolia are available. This option is only for the duration of the COVID-19 public health emergency. Do not administer Prolia until you have been taught how to inject it by a healthcare provider. Can Prolia be given intramuscularly? No. Prolia is not injected into the muscle or a blood vessel. It is only given as a subcutaneous injection, which means it is injected under the skin using a short needle. Your doctor or nurse will give you this injection. This is not all the information you need to know about Prolia, denosumab, for safe and effective use and does not take the place of talking to your doctor about your treatment. Review the full Prolia information here, and discuss this medicine and any questions you have with your doctor or other healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.